First of all, I thank you for the wonderful introduction, ma'am. Good evening, and once again, a warm welcome to everyone. It is a pleasure and honor to share this virtual dais with many renowned ophthalmologists. I'm sure that everyone will agree with me when I say that excellence in medical documentation reflects and creates excellence in medical care. I'll be speaking more about this as my topic for today. Documentation of critical communication is only a reiteration of the same. We are all familiar with this phrase what is not documented is not done. Documentation is an integral component of good professional practice and the delivery of quality healthcare. I want to highlight the fact that when we talk about critical communication, we are not only talking about communication between doctor and patient, we are also talking about communication between doctor, optometrist, patient, patient coordinator, surgeon, OT nurse, and all other hospital staff. I'm sure your minds are racing with the endless possibilities of person to person interactions, which form a part of critical communication. Regardless of the form of the records, whether it is electronic or paper, good clinical record keeping should enable continuity of care and should enhance communication between different healthcare professionals. These records are also valuable documents to audit the quality of healthcare services offered and can also be used for investigating serious incidents, patient complaints, and compensation cases. One must also keep in mind that these documents are part of legal records admissible in the court of law. This is one more important reason to maintain meticulous records. Like I said earlier, good record keeping is not only the job of the medical director or the doctors, but each person working in a healthcare organization has a role to play. Whenever or wherever appropriate, all members of the multidisciplinary team that are involved in a patient's care and in the smooth functioning of the healthcare organization should do their valuable bit. In the interest of time, I'll not be able to give an exhaustive list of situations where documentation of critical communication plays a crucial role, but I would like to discuss some case scenarios which we all may be familiar with. Here are some of the outpatient doctor patient communications which need to be well documented for both the sake of the doctor and the patient. For patients diagnosed with glaucoma, it is important to explain to them about the progressive nature of the disease, need for the compliance to medication, and importance of regular follow up. In case of patients with diabetes, they need to clearly understand the importance for strict glycemic control. The importance of early intervention to prevent worsening must be explained to the patients with age related macular degeneration. They also need to be compliant with the follow up schedule. The needs and expectations of patients due to undergo cataract surgery should be considered while explaining the procedure to them. The visual prognosis and complicated cases must be communicated in clear terms. All this should be properly documented. And it goes without saying that documentation of each of these issues will play a vital role in ensuring that your patients are happy and that you get a good night's sleep. These are some of the examples of critical communication with the patient that we maintain at our hospital. They may seem trivial at a cursory glance, but can make a huge difference in the well being of our patients. We have made bilingual seals stressing the importance of continuing anti-glaucoma medications till further notice and using steroid eye drops only for the period indicated. These seals were born out of situations where we wished we had communicated to our patients better. In case of argumentative patients, trying to imply it is our fault that some untoward incident had happened, these can be used to transform the same patient into an apologetic one. We also make it a point to mention drug allergies on the patient's file and in our software. When we started this practice, we found that so many of our older patients on subsequent visits had known drug allergies, which we were not aware of, just because we had never asked till then. Now let's move on to communication in the case of patients scheduled to undergo cataract surgery. This is of vital importance in all our practices. These can be categorized into pre, intra, and post-operative. Let us start with pre-operative communication. As you can see, each of the items mentioned in the individual boxes is an important piece of information to all members participating in the surgical process. One such example is that the patient is on medication for benign prostatic hypertrophy, and this has to be communicated to the surgeon so that he or she is prepared for a floppy iris during the surgery. These are some of the forms which we count on to ensure there are no hiccups. These may be tailor-made to each of your practices. Now, we look at the intraoperative stage. Again, there are various parameters, none of which can be overlooked. We practice a timeout before starting the case where we specify the name of the patient, eye to be operated, intraocular lens power, and plan of the surgery. There was an incident where the surgeon remembered that IOL power mentioned during the timeout was not the same as the one mentioned when the IOL package was opened. The OT assistant usually calls out the intraocular lens power before opening it, and this is verified by the anesthetist. Now, let's move on to the post-operative stage. Extra chair time spent in explaining each of these will go a long way in ensuring you have a happy and a satisfied patient. This is usually done at our center by our counselor. Here's a quick glance at one of our checklists and our post-op medication list with timings and dates. Let us quickly move on to critical communication with the team. Our equipments are an important part of our arsenal. There are times when we have struggled because there is a loose contact in our slip clamp wiring or some big problem which our in-house maintenance person is unable to address. This is where the breakdown register comes into the picture. The person who first detects the problem notes down the same in this register. This information is conveyed at our center to our center head, who further communicates with the concerned company official to handle the problem. If the said instrument is critical and has no backup, like say the Humphrey field analyzer, then turnaround time has to be short so that work doesn't suffer. Maintenance of incidents or adverse event register is important to handle mismatch in communication. For example, if staff has instilled wrong eye drop or eye drop which the patient is allergic to, it leads to adverse effects. So this can be prevented by root cause analysis, preventive and corrective action, and communicating to the team so that this will be avoided in future. To have a better communication with other specialty doctors, we maintain a record of patients referred to them. Telephonic call is made to the doctor and explained detailedly regarding the patient, and referral letter is handed over as a part of documentation. So this helps the doctor to understand better about the patient. Along with this, even a SMS is sent to the specialist about the diagnosis and advice. So to conclude, the palest ink is better than the strongest memory. So don't forget to document. So today I thank you from all of our Samandar